The phase 2/3 ATOMIC-Meso trial was a double-blind, randomized, placebo-controlled trial in 249 patients with non-epithelioid mesothelioma. Approximately half the patients had sarcomatoid and half with biphasic. Patients had to have PS ECOG status 0 or 1. 125 patients received the experimental arm of Pegargiminase and chemotherapy, and 124 patients received the placebo chemotherapy arm. Patients were allowed up to 6 cycles of triplet treatment or with the placebo and the doublet chemotherapy, and then could go on to maintenance injections for up to 2 years with either the Pegargiminase experimental drug or placebo. The treatment was given weekly, and patients were scanned every 6 weeks while on study. So the primary endpoint was overall survival, and there was a statistically significant increase by 1.6 months. P-value was 0.023. The survival in the placebo chemotherapy arm was 7.7 months, and in the experimental arm it was 9.3 months. The secondary endpoint was progression-free survival, and for a mesothelioma study this was also met, which is unusual generally for progression-free survival endpoints, and the increase was 0.6 months for patients over the placebo arm. Response rate was assessed in the study at the phase 2 only by blinded independent central review, and there was actually no difference between the two arms. It was roughly 14% in both arms. Again, this is not surprising in view of the difficulty in measuring mesothelioma on a CT scan. Other endpoints included pharmacodynamics, so reduction in arginine, which was confirmed, and a reciprocal increase in citrulline, which was maintained out to 25 weeks of measuring these two amino acids. There was also assessment of immunogenicity, and there was an anti-drug antibody response measured in approximately 98% of patients.